Hi everyone, my name is Rebecca de la Aguila. For this presentation, I was assigned Haemophilus influenza. So before we discuss the actual infections or diseases caused by Haemophilus influenza, we are going to go look into the basic characteristics of the pathogen itself. So listed here is the basic taxonomic hierarchy classification of the pathogen. Since we know it is a bacteria, we know that it does not have a kingdom assigned to it. I don't plan to read down the list, but I just wanted to show you its basic taxonomy. Briefly looking at its morphology, Haemophilus influenza is a gram-negative bacteria. Its shape is pleomorphic bacilli, which ranges from cocobacilli to long filaments, and it also does not have flagella, which means it is incapable of movement. Haemophilus is derived from Greek, and its literal translation means blood-loving. This is because Haemophilus influenza requires hematin, or factor 10, and NAD, or factor 5, to grow, both of which are found in red blood cells. Haemophilus influenza is a facultative anaerobe, and it grows best in media enriched with CO2. It is also catalase and oxidase positive and considered a mesophile. One might think that it would grow better on blood agar because of its requirement of factor 10 and 5, but instead, Haemophilus influenza grows best in chocolate agar. Haemophilus influenza disease is a name for any infection caused by H. influenza. There are 6 identifiable types of H. influenza and other that are non-identifiable. The one that people are most familiar with is H. influenza type B. Here is a list of infections most commonly caused by H. influenza type B. They include meningitis, epiglottis, pneumonia, cellulitis, arthritis, and ear infections. And for the rest of the presentation, we're going to primarily focus on meningitis. Meningitis is an infection of the membranes covering the brain and spinal cord. This covering is called the meninges. It can be serious and in some cases fatal in as little as few hours. It can also result in permanent disabilities such as brain damage, hearing loss, or learning disabilities. As mentioned earlier, meningitis is an infection caused by H. influenza type B. This is a bacteria that lives in the noses and throats of humans, but sometimes when it spreads to other body parts, it can cause illness. The most common port of entry for this pathogen is the nasopharynx. It is considered a communicable disease, and it is spread when there is contact with infected respiratory droplets or discharges, which can spread via coughing and sneezing. Here we're going to discuss how H. influenza type B actually causes meningitis. So the bacteria travels in the bloodstream to infect the meninges. This causes the blood vessels in the lining of the brain to be damaged, which allows the bacteria to break through and infect the cerebrospinal fluid. Then the meninges become inflamed, and the pressure around the brain can cause severe nerve damage. So to continue, as the bacteria multiply rapidly in the bloodstream, they begin to release poisons from their outer coating, causing septicemia. The toxins in the blood damage blood vessels and stop the vital flow of oxygen to the organs, including the skin and underlying tissues, and consequently, this causes widespread damage to the rest of the body. Septicemia also gives the appearance of a rash, as pictured here, and that's common among individuals infected with meningitis. Here are the common symptoms associated with meningitis. You have fever, headache, stiff neck, nausea with or without vomiting, photophobia, which means basically sensitivity to light, and altered mental status, which includes confusion. So here are some signs of meningitis that are seen in newborns. They include high fever, constant crying, excessive irritability, poor feeding, or in some cases, stiffness in a baby's body or neck. So here we're looking at some common diagnostic or detection methods used to diagnose meningitis. The first one is blood cultures. This is where blood samples are placed in a special dish to see if it grows bacteria. The second one is imaging. This is where CT or MRI scans of the head are used to see if it shows any type of swelling or inflammation. Then you have the spinal tap or lumbar puncture. This is where you will need a spinal tap to collect cerebrospinal fluid. And in people with meningitis, the CSF often shows a lower sugar level along with an increased white blood cell count and increased protein. So here I included an image of a brain infected with meningitis. So if you see where the yellow arrow is pointing, it's showing a creamy, filmy layer on top of the brain, and that is the infection itself. So the treatment for meningitis requires rapid admission to a hospital and immediate treatment with antibiotics. These antibiotics help combat the infection and thus reduce inflammation in the meninges. In some cases, there is drainage of infected sinuses or mastoids, and if treated promptly, meningitis is less likely to become life-threatening. So, getting the HIV vaccine is the best method of prevention against meningitis caused by Haemophilus influenza type B. It should be noted that this vaccine does not prevent disease caused by other types of H. influenza, but there are also other methods of prevention, which include careful hand washing, good hygiene, and being and staying healthy. Okay, so moving on, some populations or geographic regions mostly affected by HIB include Alaskan Eskimos, Navajo and White Mountain Indians, Australian Aboriginals, and among some populations in Africa as well. Okay, so frequency of infection. The World Health Organization estimates that HIV causes 3 million episodes of serious disease and 400 deaths annually worldwide. And most cases are among children that do not have the HIV vaccine or are in economically developing countries. Okay, so here is a report of a recent outbreak of Haemophilus influenza type B in Minnesota in 2009. The article reports on the death of a young infant caused by HIV meningitis. It goes on to state that Minnesota hasn't had a death related to HIV since 1991, most likely because most children are vaccinated now. This kind of shows how important it is for HIV vaccine to be included in all routine childhood immunization programs and why parents should be eager to vaccinate their children and avoid tragedies such as this one. For this presentation, I did get a lot of my information from the CDC, but I also used some other sources, so here I have cited them. So that concludes my presentation on an infection caused by Haemophilus influenza. So I hope I provided you with some valuable information about the pathogen, and I'm open to receiving any questions that you may have about it, and I'll do my best to answer them. Thank you.